Hi, my name is Lekisha Robertson, and I'm doing a project for my learning seminar class in regards to medical imaging. This is Baba Tunde, and he's a medical imaging professional. Bobby, what is your profession in medical imaging?
Nuclear medicine technology is my field.
Okay, and in nuclear medicine, what is it that you do?
As a nuclear medicine technologist, I do physiological study. That is how the body functions
Mm-hmm.
and different variants
Mm-hmm.
from normal to abnormal
Okay.
to help the patient and for the doctors to make correct diagnosis.
Okay. What are the requirements into becoming into this field?
Well, they have two ways. You can do associate, which is 2 years, or you can do BS, which is 4 years.
And you have
Yes.
Vivian. Oh, okay. So, Bobby, how long have you been doing this?
I've been doing it for 15 years.
Really? Do you like what you do?
I love it.
Yeah. How's the pay?
The pay is good. I mean, you can swear. You cannot. It's the best. I love it.
Where do you work at now?
Well, I work all over as a subcontractor. I work on my own, working, filling in at different hospitals at the moment.
Do you get paid more because you do that particularly, or?
Well, it depends on how you look at it. You get paid more, but then you got to carry your own medical insurance and all that. So it always goes up.
Gotcha. So what shifts do you work when you do that?
I work day because in the field of nuclear medicine, most of our studies are during the day.
And why is that?
Because you're doing physiological studies. That's how the body functions. We want to get accurate baseline studies. When you first wake up in the morning, your body has rested.
Mm-hmm.
So whatever problems you have,
Mm-hmm.
it can be detected early in the morning because your body is rested. Your metabolism is at 0.11 hours. But as the day goes on, you get busy, and then all your hormones and your body start functioning. So we cannot get accurate studies. We like it to be first thing in the morning.
Oh, okay. That's good to know. I didn't know that. So how many hours do you work a week doing this?
Right now, I'm not on full time, so I work between 20 to 32 hours because of my personal things that I do.
Okay. Do you love doing it?
I love it. Helping people.
Good. That's nice. Um, Let me see. How have you ever had an irate patient, or how is it difficult to deal with, certain patients?
That's a very good question, Kish. In the medical field, you're always going to be having irate patients. And that's why you got to be calm, cool, and collected. Always, you're not doing it for money. You're doing it because you love people. You are a caring person. When patients are sick, they come to the hospital.
Right.
And they are not at their best behavioral level.
Right.
They are all worked up, stressed, worried, confused, So they're looking on you for help.
Mm-hmm.
So you got to be helpful. You got to have understanding. You got to put yourself in their shoes and treat me personally, and I know everybody does. We try to treat them with love and understanding and compassion, and then treat them as a family member.
Okay, gotcha. Why did you choose this field particularly?
Because I'm curious about the nuclear medicine field. I know I love science, but also I love people. So if I can use my science to help the people, hey, equation balance.
Is there any danger in this job?
Oh yeah, there's danger. Danger of exposure to radiation. You can over-radiate the patient and make them sicker, cause more problems for them.
Right.
And you can over-radiate yourself
How?
by exposure. but we have things we do to protect ourselves. They will teach you that in training, you know. Number one.
I'm sorry to cut you. Is there a particular, like, because you're in that field and because you're around radiation, are you a person that has to get tested frequently to make sure that you're okay, or?
Yes, we do that. That's a very good question. We do that. You see, we wear badges.
Mm-hmm.
The badges, a lot of people don't understand. They say, oh, they see you with the badge. They say, no, 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 I don't want to be exposed to radiation. But no, the badges is just a recorder. It's like me and you are talking now, the camera is rolling, it's recording what we're saying. So the badge is recording your exposure to radiation. In the nuclear medicine field, we are exposed to radiation full force. Number one, when you're mixing the medication. Number two, when you're injecting the patient. Number three, when you're working with the patient. Unlike other fields of radiology, nuclear medicine, the patient have the radiation injected into them. So the camera doesn't have the radiation. The camera is just recording what it sees, and the badge is recording your exposure to patient. So our major protection is quantity of the radiation you inject into the patient and your exposure to the patient and to the medication. The more I inject you and the longer I stay with you, the more I'm exposed. So it's like you inject and then you got to do what you got to do, fast and precise.
Okay. Great. Well, apparently you guys see this is what you need to do to become professional in medical imaging, as far as nuclear medicine, X-ray, CT scan, or whatever have you. It's all part of medical imaging. And me, myself, I want to do X-ray. So this insight from hearing from him, even though it's nuclear medicine, it's all part of medical imaging. It gives me an outlook on how things are done in the imaging field and how you can expose yourself as well as the patient to radiation. Now, one more question I do have to ask you is, as I'm doing this study, and I was looking up different, disadvantages and advantages of things that can happen. And one of the disadvantages that I looked up is when you're exposed to so much radiation, it can cause cancer.
Of course.
Now, working in this field for 15 years, you said, do you know anyone that's ever been exposed and got cancer because of doing this type of thing?
Well, I do know some people, but I cannot say categorically that it's due to radiation. Whether you're exposed to radiation or not, you can get cancer regardless. But if you're exposed to it more, your chances, the probability of you getting it is heightened, increased. That's why we have the badges there. Every month, they take the badge to some scientific laboratories and they check your number of exposure, the level of exposure, compared to what the government says you should have. And when you almost reach that limit, they let you know.
And that means that you're at high risk of being exposed?
Well, it means you are exposed more. So what you want to do is maybe you will take a few months off to cool down, or they will find out why are you so exposed. Because if you are careless, see, we're getting exposure every time. When we are in the hot lab, that's where we keep the medication and the radiation stuff we use, and we are always injecting. Unlike other fields in the medical field, the radiation comes from the machine. But in nuclear medicine, we are injecting the patient and we are preparing it. If you are careless with your preparation technique, what can I say? That's why you got to know what you're doing. You want to go there, no messing around, do what you got to do, and get out of the hotline as quickly as possible.
Wow. That's good to know.
And then we have shield, of course, less shield to cover the syringes while we're exposing the patient. So, in a way, you cannot be overexposed if you follow the protection technique that they teach you.
So, how long does one of these tests usually take?
It depends. We have studies going from 15 minutes to about 72 hours.
Wow.
There is no 15 minutes is for liver. For something like lung, you can knock it out about 45 minutes at the most. Something like bone, depending on what you're looking for, that can last for about 3 hours. But it's not that the patient will sit down there 3 hours. You take the first one, then they come about maybe 10 minutes to do it, then they come back 3 hours, you know. And when you talk something like heavy studies, like gallium studies, which we do for infection, that can take about 3 days. But it's not like they're going to be there all that time. They come maybe 30 minutes, and then you're done. Then they come maybe another 12 hours, then maybe 24 hours, maybe 48 hours, maybe 72 hours, depending on what you're looking for.
Okay. Well, can I ask you if you have any encouraging words for my classmates that are in the medical imaging field and as well as other medical?
That's a very good question, Keith. My advice to you is don't get into the field because of money, okay? Because if you get in there because of money, you find that everything that glitters is not gold. Money is not everything. You will make the money, but will you be able to treat your patient with compassion? Will you be able to go that extra mile when the patients get nasty with you? Because it's not always pleasant. But if you love your people and you love God, always treat your patients like your family. That helps me a lot. Then I look at it like whatever I'm doing to them, hey, what if I get sick? Always put yourself in that situation. Let that be your main priority every time. Because it's not easy. When you want to quit, when you want to lose your temper, consider yourself. Nothing is guaranteed. What if you are sick? In other words, what I'm saying is treat other people the way you want to be treated, and your day will be blessed. Because the joy comes from treating these people when they are sick, like a family member. They will be nasty with you and all that, but believe me, they don't mean it. I've treated so many patients when they are nasty with me. Sometimes I'll take a break. If you have a real difficult patient, which you cannot handle, talk to your supervisor. We always help each other out, everybody in the field. You say, yo, Joe, I'm having a difficult time with that patient. You want to take over, and your co-workers will have a better rapport with them. But don't think Miss Know-It-All or Mr. Know-It-All. It's a personality conflict all the time. But if you have an impatient and irate patient, call somebody else to handle it for you. And remember, at the end of the day, you will go home with joy in your heart to know that you've done your best to help somebody get well. That's what it's all about.
Well, I hope that is enough evidence for you guys to make it through the program and stick out and don't let any obstacles come in your way and succeed in what you want.
Amen.
Thank you.
God bless and good luck with your studies. Remember,
Hang up. You didn't hang up.